St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana, na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center
good morning. Thank you for joining us on our Health Talk Show with me, Maureen Kimani, a program that is brought to you by Capuchin TV in partnership with St. Mary's Mission Hospital in Langata. And the reason why we bring you this live show is to help you and to create awareness that you must keep fit, you must stay healthy, and we say, let's talk health. And today we're going to be talking about cervical cancer, and they call it cervical cancer screening. And the reason why we're bringing this topic to you, it's because all women are at risk of for having this cervical cancer. So the reason why we're bringing you this live show is to help you and to understand some of the signs and symptoms, and to make sure we create awareness, and to make sure that every woman has gone to this screening of cervical cancer, and to make sure that you are free of cervical cancer. Welcome, and my name is Maureen Kimani, and joining me in the studio we have a guest from St. Mary's Mission Hospital. She will be introducing herself and telling us what does she do there and her name. A very good morning, lady. How are you? You look beautiful, by the way.
Thank you so much.
Yes.
I'm Joan Kamau. I'm working in St. Mary's in the CCC department. I provide services for HIV and AIDS, as well as TB. Yeah.
Thank you so much for making time for our health talk show right here on Capuchin TV.
Thank you.
You're most welcome. Yeah, and in case to you, our view, you have any questions about this cervical cancer or cervical cancer, you can make sure you send them to us on 0717-424-866, or you can use our SMS number that is 21760. Let's talk health. Well, you're talking about cervical cancer, which I said people call it cervical others.
Yeah.
What is it all about?
So cervical cancer is the cancer of the cervix, and the cervix is the lowermost part of the uterus that opens up into the vagina. So basically, as the name suggests, cancer of the cervix. Yeah.
And we can see that every woman is at risk of having this cervical cancer.
Yeah.
Maybe you can tell us the age preferences?
Well, usually it's common in women in the reproductive age. So as long as you're in that bracket that is 25 to 49 years of age, you're at risk of getting cervical cancer. But it's more common between the ages of 39 and 49. Yeah.
Okay, and maybe you can give us some of the statistics globally and here in Kenya.
Okay. So it's a burden globally. It accounts for 341,000 deaths all over the world per year, and usually there are 641 cases every year. So there are new cases as well, and what will I say? It's more common in the eastern region of Africa, and Kenya, we are part of it. And for every 100 people, every 100 women, 40 of them are more likely to get cancer, and also between that bracket, 30 of them are more likely to succumb to it. Yeah.
Okay. Women are very important people in our society, and you're talking about this cervical cancer, of which it occurs in female, that is, we're talking about women. What are other cancers that affect women?
The most common ones are cervical cancer and breast cancer. So they are the only ones linked to female people. And also we have ovarian cancer, uterine cancer, basically the reproductive organs of all female parts. Yeah.
Thank you so much, Joan.
You're welcome.
And what are some of the causes of this cervical cancer?
It is believed that the human papilloma virus is the leading cause of cervical cancer. However, there are so many strains, over 100 of them. The most common ones are HPV 6 and 11. However, these two do not cause any cancer. And the ones that are notorious or more common to cause the cervical cancer, that is the HPV 16 and 18. Yeah.
And can this cervical cancer be hereditary?
Yeah, in families that actually are more prone to get cancers, it's actually one of them. So if your mother had cancer, that is of the cervix, you're more likely to get it. However, it is not a must. Yeah.
And let's talk about, you just mentioned about HPV, that human papilloma virus. What strains are HPV of cervical cancer?
There are so many, like I said, there are from over 100. But the most notorious ones are 16 and 18. We also have from 30 to 45, but the most common ones, like I mentioned, is just 16 and 18, because they account to over 70% of the cases that usually cause now the cervical cancer. Yeah.
And you just mentioned about the age, that is 35 and above for these females. And now you find in our society that we have these ladies very young who are sexually, sexually active and they are at a very early age. Can they be prone to this cervical cancer?
Yes, it is, because it is sexually transmitted. And like you mentioned, it is unfortunate that we have ladies and even young girls who have an early debut to sex, and actually they can actually contract it. So there's no age limit, actually, I might say.
And what do you have to say about these girls?
Well, we should just empower them and let them know that it is there, it is possible, you can actually contract the disease, and we need to educate them more on how to practice safe sex practices. Yeah.
And what are some of the risk factors of this cervical cancer?
Or the lifestyle that we actually choose to partake. If you choose to drink and smoke, you're more predisposed to getting cervical cancer. Also having many sexual partners, getting recurrent or many frequent sexually transmitted diseases. Genetics as well is a risk factor. Maybe you come from a family that is prone to getting cancers. And also not practicing safe sex. I think that's pretty much it, yeah.
Okay, and just to mention some of the myths that people think this cervical cancer can be a curse. Do you think so?
Well, it's not a curse, actually, I would say. It's just unfortunate that someone actually gets it. And there are other myths that are even related to the screening. Many say it is painful. Well, actually, it is not. The only thing that one may experience is a bit of discomfort while doing the procedure, because we have to insert a speculum for us to locate where the cervix is. And then others believe that you cannot even do the procedure while you're on your menses, and you can actually do it. And nowadays it has been updated that we can also screen pregnant women, however that is 18 weeks and below. And yeah, those are some of the myths that are actually there.
And let's talk about the screening part, because you just mentioned it right now. What are some of the methods that you use to screen this cervical cancer?
The common ones that we have VIA, which is an acronym for visual inspection using acetonic acid. We insert the speculum, locate the cervix, and then we spray the acetonic acid, and then we wait for 1 minute for the results to come out. We also have pap smear, same thing. We put in a speculum, locate the cervix, and then we swab using a small brush so that we are able to collect a specimen, then subject it under a microscope, and where we can actually tell whether you have cancerous cells or not. We also have we do colposcopy, where we use a special magnifying device where we visualize the cells using that device after we've inserted the speculum and we've located the cervix. We also have via Vili. That is also using acetonic acid or Lugos iodine. And then we just wait for the results to come out. Yeah.
And maybe you can take us through some of the stages of these cervical cancer and some of the signs and symptoms, because I know stage 1 is different with the last stage.
It is. So I'll start with the signs and symptoms. So usually it is unfortunate that some women do not even have a single symptom, and now that is why we encourage the screening. However, when one progresses, you can have cramping, that is pain on the lower abdomen. Others have pain during sex. You can also have bleeding right after having sex. And also we have people who have vaginal discharge, which is a lot, and it might have a certain order to it. And also bleeding in between your menses. Those are the signs and symptoms that we have. And we have different stages from 1 to 4. Stage 1, this is where it is located within the area of the cervix only, confined to the cervix. And then stage 2, it is in the cervix and the uppermost part of the vagina. And then stage 3, it is inclusive of the whole part of the cervix, inside and out, and extending all the way to the lower part of the vagina. And then stage 4, it is everywhere, the lower part, the upper part of the vagina, in the cervix, and it has also spread to other organs, maybe your rectum, your bladder, and it can even go to the lungs or the liver. Yeah.
And can this cervical cancer be maybe is well, before you reach to the last stage? Can it be prevented?
Yeah,
if it's diagnosed early in the first stage?
Yeah, okay, well, it is preventable. One, before we reach sexual debut, we encourage girls to be vaccinated, especially towards HPV 16 and 18, which is the most notorious one. And then using condoms while having sex, being loyal to your partner, only being with one sexual partner, as well as the most that is paramount is screening, regular screening, because once we see that it's early, or rather when we detect the HPV virus when it is in its early stages, we are able to eradicate it and prevent it from spreading further to become cervical cancer. Also, when women have other reproductive issues that require prevention, because there's no need for the cervix to be there when actually the uterus has already been taken out. So why keep the cervix? Just take it out and protect the woman from actually getting cervical cancer.
Okay, and who is eligible?
You are eligible. If you're not a virgin, then you're not eligible. Those women who undergone TH, that is the removal of the uterus and all whatnot, they're not eligible for actually getting the screening.
Let me take you back. You just mentioned about discharge order, and you find that there are very various types of discharge. Maybe you can take us through what are these types and maybe how the color and the smell, because I know there's some that smells fishy.
Indeed.
Yeah.
Okay, so upon screening, yes, we do meet these kinds of discharge that any woman has. The clear one is actually normal. Others have creamy, that it's normal to some extent. However, there are other discharges that are whitish and card-like. They look like maziwa mala. That one now we call it yeast infection. And then we have the yellow one, which is an STI. It can be trichomonas vaginosis and whatnot. And then we have the gray one, which is bacterial vaginosis. And then we have now the brownish discharge, which now we actually suspect it could be now cervical cancer. So I encourage women to be in tune with themselves, and if they notice any smell or odor towards it, it can be fishy, and it can be different for anyone, because sometimes you actually know yourself. So sometimes when you feel a bit of fishiness, some tanginess, or it's pungent, that is when now you should actually go to a healthcare worker and then find out whether things are okay or actually not.
As you continue with the signs and symptoms, you mentioned about the bleeding part, and you find that some women maybe prolong their menses maybe for a week. How long is this bleeding does go?
Okay. For some, actually, unfortunately, it's non-stop. Like they have frequent spotting, frequent bleeding, associated even with clots and whatnot. You cannot per se put a duration to it, but usually when, let's say, you used to experience your periods in 7 days, now it's 14 days. It depends on a particular individual. Like if you know your cycle goes only for 4 days, bleeding for 4 days, verified. Yeah.
Okay, and upon screening, what are you likely to find out?
We find tons of things, of course, while applying the one that I do mostly back in St. Mary's is the VIA. Of course, you might either expect to be positive or negative. So when it is positive, the cells absorb the liquid part and then they turn into white because the HPV virus readily takes in the acetonic acid and then changes color to white. So that's when we deem the person viably positive. And sometimes we can even find other abnormalities like polyps, maybe Nabothian cysts. Sometimes we even find a cervix that is inflamed or even malformed and whatnot. But according to whatever we find, we manage it as per the findings and what someone needs to be intervened for. Sometimes we find discharges, like I had mentioned, and then we treat. If it is bacterial, we treat. If it is yeast, we treat as well.
And because you're almost going for a break, and in case you're joining us right now, we're talking about cervical cancer screening right here in the studio. We have a guest from St. Mary's Mission Hospital. That is Joanne Kamau, who is a clinical officer there. And I think you're going to tell us about your experiences in St. Mary's Mission Hospital when you come back, about this cervical cancer screening, what you have found out. Do these patients with cervical cancer have this trauma and they feel they're no longer going to survive? Because sometimes you find these myths in the society. If you have a cancer, not only for the cervical cancer, any type of a cancer, you won't even stay for 5 years. That is longer than 5 years. You might die. People talk about that. And maybe you can tell us do you offer maybe these services of helping these patients to deal and to accept and to move on and to go on with the medication of this cervical cancer screening.
Okay.
All right. Okay. We're going to take a very short break on our health talk show, and stay tuned because we have much to talk about when we come back. If that is the treatment and if it can be prevented. And we have heard about the lifestyle. So many people don't know how to take care of themselves. That is in terms of exercising, in terms of if you notice some of unusual thing in your body, you have to go to a hospital for this checkup. So stay tuned for this health talk show. When you come back, we have much to talk about, and in case you still have a question, keep them sending them.
Capuchin TV, your Catholic broadcasting ministry. St. Mary's Mission Hospital is a faith-based Level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walishughulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyu mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center. Welcome to St. Mary's Mission Hospitals. Compassion in healthcare.
Capuchin TV, your Catholic identity.
Welcome back, dear viewer, to our health talk show with me, Maureen Kimani. And in case you're joining us right now, we are talking about cervical cancer screening. And in the studio, we have a guest from St. Mary's Mission Hospital. That is Joanne Kamau, who is a clinical officer there. And welcome back, Joanne.
Thank you.
Before we continue, we have a comment here from a male, actually, who is following us. That is Chris. And he's saying that, good morning, Madam Host. I know I cannot contract cervical cancer, but what are some of the myths about it that ladies should be careful about? I think you can answer that.
Okay, that's a very interesting question. So I think the one that many people don't actually know, it's not only sexually transmitted. You can actually contract it from the HPV. Actually, you can contract it from surfaces, like maybe from toilets. Maybe someone used the toilet and they have HPV. So the HPV is actually a fomite. It's just like COVID. It can actually land on surfaces. And once you touch it and then touch yourself, the HPV now runs up through your vagina and then lands on your cervix. So women should also be careful while using toilets and whatnot. What I actually tell people, wash your hands before you use the toilet and actually after you use the toilet. Yeah.
Sorry for cutting you. When you talk about the toilets, does it mean even the splashing of the water can maybe...
Mostly the ones that we actually sit on, the latrines are okay. The likelihood of it splashing and coming all the way to you, the chances are nil. And I'd also like to tell our dear viewer that men actually are carriers of HPV. They are not affected mostly, but the HPV usually stays on the shaft of their penis and most of the time the scrotum. So that is how now it is sexually transmitted. Yeah, that's why we also encourage someone to use a condom. Yeah.
Okay, thank you so much, Chris, for that question and for noting that out to our sisters and your friends, your cousins, the female around you.
Exactly.
And before we had gone for the break, we were talking about maybe you can give us some of the experiences that you have encountered in St. Mary's Mission Hospital as per our topic is concerned.
Okay. So some of the women are usually scared when they're being asked to screen. Like in our clinic where I work in CCC, we encourage that every woman should screen at least once every year. Actually, it's mandatory that if you're living with HIV and AIDS, you should screen every year. So while at it, a majority of them usually say it is painful. Others have actually gone through it. In the earlier days, people used to use speculums that are made of metal. So anyone who thinks that a metal is going to be inserted in their vagina, they actually get scared. But what they don't understand is just a device that is inserted to locate your cervix. Nothing is going to be done there, like maybe taking of... they say, nakuchuna nyama, but no, actually it's not the case. That device is actually used just to locate your cervix. It's not painful, you just need to ease into the procedure, because when you're scared, you contract the muscles, then the healthcare provider finds it hard to insert the device. But once someone is calm, they breathe in and out, we put the device there, and then we are able to locate the cervix, and then now we can actually go ahead with the procedure. It is very easy. It only takes about 3 minutes. That is the VIA system, and we just spray onto the cervix, and then we wait for the color to change within 1 minute, and then we give the client the results. And then for the pap smears, we just use a brush, we just collect the specimen, and then we put it on a slide, and then we take it for viewing under a microscope. And it is very simple. Once there was an experience where I had a lady who was very scared, had gone under other procedures like HSG, where she was trying to actually see whether what's the problem of her not conceiving. So there's that imaging that is done to view the fallopian tubes. So the experience for her was very horrendous. So it was very painful, and she thought that I'm going to do the same thing. But once we explain the procedure, we let them know how it's going to be done, we ease them into being calm and all that. She found it very comfortable. She didn't have any problems. And many think that you'll go in there, start screaming and whatnot. I asked her, did you even hear anyone screaming from this procedure? No, she was actually shocked. And as we speak, she's an ambassador actually. She encourages other women to go through it. It's not even painful at all, at all.
That's so amazing.
Yeah.
And before you take us through the treatment part, maybe you can tell us, or maybe some of the cases that you've just mentioned you have encountered in St. Mary's Mission Hospital. Do you think our patients, when they were coming to the hospital, they thought they were having the cervical cancer screening, or they just find out that it's not another disease, it's just cervical cancer?
Yeah. So actually for our women in our clinic, what we actually tell them is that we are screening. We are not actually going there to diagnose you, but in case we find out something is going on there and you have the HPV, there are treatment options that are going to be there. So actually for them, it comes as a shock that they actually need to be screened, but now luckily now we have women who are now empowered, and they know that this is something that they actually needs to be done. However, it is unfortunate that some of the women that who've turned positive had no symptoms at all. The more reason we keep insisting that someone should actually screen regularly. So however, we've had success stories. We have 3 women who are VIA positive, and we've treated them, and they're doing very well, by the way. So it's not a death sentence, if I may say. Once it is caught early, we are able to intervene, and then we eradicate the virus so that it does not progress later on to become cervical cancer. So in actual fact, we are not actually looking for the cancer. We need to get the HPV, that is the causative agent for getting cervical cancer. So once that is seen, we eradicate it, and then it's also a preventive method. If the HPV is not there, there's no way the cancer will actually develop. Yeah.
Okay, now take us through the treatment part.
Okay. So once we get the HPV virus, when it is lodged in the cervix, we have treatment options such as cryotherapy. This is a method where we use nitrogen oxide. It's like an ice cube of some sort, and then it is placed on the patch of where we found the cells, the HPV virus cells, and then it freezes it, and then the HPV virus dies. Then we have thermocoagulation. We use a certain special device where it has some heat, and then we place onto whatever patch that we found the HPV virus, then we burn it actually. Just like nyama choma, you just place it, then it's cleared. And then once it is progressive, maybe like stage 3 or so, we encourage someone to go and have the cervix removed. And then once it is stage 4, that is when it has progressed into the entire pelvic organs and whatnot, we encourage someone to go for chemotherapy and radiotherapy. But what I would like people to know is that the earlier, the better. That is, will also improve the success rate of your treatment. And then we follow you up within a year's time, and then we see how good you're going on. So let's not actually wait until we have the option of radiotherapy or chemotherapy when actually we have better treatment options, because it is same day, same time treatment. If we find it, we treat it there and then. Yeah.
And why is it so sometimes you find that when they go for these chemotherapy, you find that some lose their hair?
Well, it's one of the side effects of chemo. It's associated with loss of hair. So actually it's just a side effect towards the treatment.
What are the side effects can one experience?
There are so many. There's nausea, vomiting, loss of weight, loss of appetite, now the hair loss that you actually mentioned, and also damage to your immune system and whatnot. They can be various terms, and then again, it's per individual. Some take it well, some do not take it well. Yeah.
Okay.
Can this cervical cancer be cured? That is, if it's noted earlier?
Well, the HPV virus can be eradicated once we get them, because they just lodge on the cervix and they have some certain projections, so they form a sort of home. So once we start the treatment options like the ones we do at St. Mary's, we have cryo. No, we have thermocoagulation. That is the most common one that we are using. So once you just embrace the HPV virus, gone, done and dusted. Someone is actually HPV free. Yeah.
Okay.
Yeah.
And can it go
to spread to other parts of the body?
Yeah, indeed. Just like any other type of cancer, once it is not taken care of early, there's tons of multiplications of cells in the organ. And now the abnormal cells grow at a very fast rate, and then they can even spread to your pelvic organs, like now from the cervix to the uterus, the bladder, rectum, and sometimes through the bloodstream it can also lodge in your lungs or even the liver. So that is now what we call metastasis. Yeah.
And what are some of the prevention methods that can be done to prevent this cervical cancer?
Okay. Number one, encourage vaccination against the HPV virus. That is against HPV 16 and 18. And actually, it can be done for both boys and girls. We said boys are the carriers, so at whatever age, 16 and above, actually. I think it's also 12. 12 can actually be vaccinated once they've not gone into early sexual debut. They can be vaccinated. So the boys will not give it to the girls, and the girls, they cannot even contract because they are vaccinated. Now the other method is regular screening every now and then, because once we get the HPV virus in its early stages, we are able to treat it and it will not progress into cancer. Also, being faithful to your sexual partner, not having many sexual partners as well. That is a form of prevention. Condomizing, using a condom, especially the male condom as well. You will not actually contract the HPV virus that actually causes cervical cancer. Also, regular checkups with your gyna. Maybe you have sexually transmitted diseases, treat them early, and also be in tune with your body. Be quick to note what is abnormal and what is not abnormal. And then as well, treating it early is also a form of prevention. Once you treat the HPV virus, there are no chances of you actually proceeding to cervical cancer.
And because you're insisting on the screening part mostly, why is it important for one to go for the screening?
Like I said, the earlier, the better. And there's nothing as important as you as a woman knowing that at least for the next 1 year I'm good to go. I'm screened today and I'm negative. And at least I'm taking charge of my own body and being responsible. So, and then again, once it is detected early, we get the HPV early, we treat it as soon as possible. So you'll not actually contract the cervical cancer. Yeah.
Okay, and in case maybe one comes for the screening maybe for this year and you're free of cervical cancer, and maybe do you need to go back again next year for this screening again? What if maybe one goes for even for 5 years for the screening and yet you're free?
Well,
what do you do?
Well, we encourage every woman, well, if you're living with HIV and AIDS, it's a must for you to screen every once a year. So if you do it in July, every July, you're due for your screening. Those that are HIV negative, we encourage once the results were negative, you screen again after 2 years. Yeah, so it's something that should be actually routine, like you and I. We should be knowing at this certain point in time, I should actually have a PAPS test done or cervical via villi done and whatnot. Yeah.
And when is this screening happening at St. Mary's Mission Hospital?
Okay, we do it on a daily, that is Monday to Friday. As an outpatient, we do pap smear, and we also have cervical via villi. So you can just come in as a walk-in and request for it to be done. Pap smear is 1,500, and via villi is 250. And for the clients that are in CCC, it's done every day and it is free of charge. Yeah.
And what advice do you give to young people, because we understand they fear to come for the screening because you just talked about the myths. It's something, it's very painful, and you just mentioned about the time that it takes. It's just about 3 minutes, and some they think after that it may cause some, uncomfortability for one. What do you tell them?
Well, the time is here and now. So let's take charge of ourselves, take charge of our bodies. Let's know who we are. It's part of loving ourselves. It's actually self-love, actually. Getting to know what's going on in your body, be empowered, and don't be afraid of the procedure. Just talk to the healthcare worker, tell them your fears and what you might be expecting there. They'll help you to understand more, and then they'll ease you into doing the procedure, so it will not be as painful as one might actually think. Yeah.
And before we went up, because we always say women are very sensitive, even with their body. What message do you tell them about being, neat and clean, the hygiene part? Because you mentioned about even the toilet, it can make you have this cervical cancer. What message do you tell them on hygiene part?
Okay, I think my take-home message here would be wash your hands before and wash your hands after, and then be careful of on sitting on the toilet surfaces and whatnot. And then hand washing is very paramount. Just take your time even in washing your hands and also cleaning yourself. And then wear 100% cotton panties and whatnot, so that you don't get these infections every now and then, so that they don't make your cervix friable and maybe easy to contract the HPV. And also, they should not get worried. Just because the risk factors are there does not mean that they'll actually get cervical cancer, but it is important for them to know, so that we reduce the chances of one actually contracting the HPV, which later on leads to cervical cancer. And then they can always come to our facility and then have themselves screened, and everything will be okay. Whatever the outcome, we are there for them. Yeah.
You're insisting of washing our hands twice before you go to the toilet
and after.
And we understand that it's very cold, so you just have to, because we want everyone to be free of this cervical cancer. And thank you so much, Joanne Kamau, for making time, for coming to enlighten our view and to create awareness of this cervical cancer, and in terms of screening is concerned. Thank you so much, and may God bless you.
Welcome. Thank you so much.
Okay, and to our Capuchin TV crew that has been of success of this talk show on every Tuesday from 9 a.m. We have Alan Andiva, we have Chris Nderito, we have Eric Otieno, Sami Bor, and lastly but not least, we have Michael Kibandi, who is our transmission manager. Thank you so much, and may God bless you. Wishing you a blessed day, and have a nice time. See you next time.
Capuchin TV, your Catholic broadcasting ministry.
St. Mary's Mission Hospital is a faith-based level 4 medical center that offers compassionate, affordable healthcare focused on uplifting the dignity of the sick.
The main reason why we were started was so that we can be able to provide quality services to those people who cannot be able to go to the high-end hospitals within the city, but they can be able to get quality healthcare.
For client-responsive inpatient, outpatient, specialized consultant services, as well as spiritual and psychosocial care, visit St. Mary's Mission Hospitals.
Some of the specialities that we have in this are pediatric cardiologist, pediatric consultant. We also have a pediatric surgeon. We also have a general surgeon, orthopedic surgeon. We have an oncologist. We also have our dermatologist department, an ENT department, and a dental department.
We also offer radiology services, maternity and mother and child health care.
Women who plan to conceive, from the time of preconception, we work with them until they conceive, or the ones who have already conceived and they would like to attend antenatal clinics. You're so welcome into St. Mary's Mission Hospital. We promise to give you the very best.
In St. Mary's, we deal with the wholesomeness of our patients. And we are very specific on diagnosis, we are very specific on supplementation, and we are very specific on even on discharge criteria.
Our hospital is fully fledged with state-of-art facilities and medical equipment, coupled with dedicated medical experts to guarantee efficient all-round services.
Ukiita daktari, hata kama kitu yenye alikuwa anafanya anaachia hapa, nakuja naona mtoto. Walisugulikia mtoto wangu vizuri. Sasa mtoto wangu anakula, anacheza, ananyonya, nafurahia sana na nashukuru madaktari wa St. Mary's. Juu sikuwa na expect kama nitarudi na huyo mtoto.
Wanashughulika kila kitu.
We have a fully equipped ambulance which is available on a 24-hour basis for both critical intubated and non-intubated patients. Both our hospitals are NHIF accredited. We also accept other corporate insurances to ensure our services are more affordable and accessible to all.
Both of our branches are NHIF accredited, and we also take insurances as long as your card is active, and you also have other insurances. Your bill will be fully catered by both NHIF and the other corporate that we do take.
We give our patients value for money because this is one of the cost-effective hospitals.
We stock affordable and quality drugs, and we have a variety of our medications to give sufficient services to our client.
St. Mary's Mission Hospital, we continue to decentralize our services for our patients' convenience, and soon we will branch out into Nairobi Central Business District at Cardinal Otunga Plaza. We will also be launching a dialysis and ICU units this year.
We also have an infectious disease unit where we have been able to manage our COVID patients. We are able to offer specialized service within this, and most of the clients are able to stay with the next of kin in the wards. We offer meals for the same and 24-hour coverage with medical officers and consultants. It is a very comfortable service, and we would wish that you would try us and you can experience what St. Mary's has to offer.
For general inquiries about our services, call us on 0777 663 441 or 0207 851 300. In Elementaita, call us on 0717 305 089 or visit our website at stmmh.co.ke. You can also send an email to info@stmmh.co.ke.
I'd encourage all to come, because when you come, you are assured of not missing the consultant. It's a good place to be.
Experience true compassionate and holistic healing, all in a one-stop medical center.